Good afternoon, all. How's it going? I'm Janelle Jones, the Vice President for Policy and Advocacy at a think tank in DC. And I'm just so excited and honored to be here with all of you. We've had such a great morning and bit of afternoon of wonderful, powerful, important conversations. And based on the folks we have this afternoon here with us, I know that that will continue. I won't spend too much time on introductions because I really want to hear what these folks have to say, but I'll do just very, very slight ones. Kate Bahn in the middle, who we heard from earlier this morning, is the Chief Economist and Senior Vice President of Research at our hosting institution, IWPR. At IWPR, and before that, at some of the most prominent think tanks in DC, including WorkRise and my current institution, Washington Center for Equitable Growth. Her research has focused on gender, race, ethnicity in the labor market, care work, and many other things. Jocelyn Frye is the president of the National Partnership for Women and Families at the National Partnership, and before that at the Center for American Progress, and before that in the Obama administration in the office of First Lady Michelle Obama. Jocelyn has worked on policymaking and advocacy on a range of issues that are important to women and their families. And finally, Khadine Bennett is the Director of Advocacy and Intergovernmental Affairs here at ACLU of Illinois. Khadine works on and advocates for a range of issues in the state capitol, including policing, AI and technology, reproductive justice, and has even written some of those laws that are now in place today. So give it up for everyone before they even become brilliant in front of us. Okay, so a little bit about why we're here in this particular session titled, research, breaking down the silos between research and policy. Often those two things are moving in different directions, and then not in different directions at different paces, with different audiences, different communication. And so over the next hour, we'll hear from these experts about bringing those two things together to really strengthen our movement and make us all better off. And so with that, a question for each of you that I want to open with. And then I'm also going to save some time for everyone else to ask questions. So please jot them down as you hear folks saying really interesting things. What is the role of research, and how can we better leverage it in our policy and movement work? And as you think about that, talk a little bit also about the importance of real-time data. Why don't we just go this way? I'll start with you.
Sure. Well, first of all, thank you, Janelle. And it's a privilege to be here. It's a wonderful conference, and you could also be sitting as a panelist. Janelle is an amazing economist, brilliant in so many ways. So I appreciate the question. I think for many of us, many of the issues that we work on are often challenging a status quo that was not built for us. It was not built for women, it was not built for people of color to be successful, to make their own choices and so forth. So anytime you are starting with a set of ideas and issues that are challenging an entrenched status quo, it is not easy to upend it without being able to say, well, it is informed by research, it's informed by data, it's not just a nice thing to do, it actually has a rationale, and here are the costs, here are the issues. So for me, research is really the key to being able to make the case for a lot of the policy ideas that we come up with. It is also the case that in a moment where change can happen really quickly, that you have to be able to be responsive. Like the best example I can think of is the fall of Roe. And we all knew that, notwithstanding what Justice Alito said, you can't just upend and get rid of abortion and think that it won't have an effect. There was ample data that told you it had an effect, but he had a different agenda. So part of what has happened, what we have done, I know IWPR has done in real time, is really trying to track what is happening on the ground. What do we see? What are the consequences? What does it mean when you stop having access to abortion, when it comes to access to maternal health care and OBGYN care? Like those things, those stories in real time have actually helped to drive change. So I think about research, I think about it, all part and parcel of the same issue, which is how do we actually solve people's problems, right? And if you're about solving people's problems, then you have to figure out, well, how do I get from A to Z? And it starts with understanding, well, what do we know about the problem? Why is it happening? Who is it affecting? Like unearthing the data and the research that can inform the solutions that you come up with. So I think of it as really all connected, to be honest, but in one piece of it being essential to really coming up with solutions that actually work.
I love that. How do we solve people's problems? Kate?
Yeah, I love the question and I love your answer, Jocelyn. I think you'll hear a lot of my response echoing some of what you said. And I think of the role of research in both policymaking and movement building sort of threefold. I'll list them and then dig in a little bit. The first one is defining the problem. The second one is building a narrative, and these two can be related. And I know we heard a lot earlier about narrative change. And then the third one is evaluating policies. And so that's some of what you were saying at the end, is figuring out solutions. So I think, when I think of one of the main tools we use for research is defining the problem, so how big it is, defining the scope, understanding the causes of the problem. And then the second piece, which is related, is we can use research to build a narrative. And so it's related, but may not be exactly the same. You referenced after the fall of Roe, what that meant. So we could say what happened to individuals, and that is a compelling narrative tool. We can also say what happens to the whole economy to sort of really emphasize a narrative that this is bad for everyone. So at IWPR, we've estimated the cost of reproductive rights restrictions since 2019 going forward. And in our most recent model, we account for the effect of bans after Roe. We find that it costs the national economy $68 billion a year to have these bans in place. And so that's, we can think about individual costs, but also we can build a narrative with those big costs. And then the last one is thinking about solutions. And so we can use research to look at policies that have been in place, how effective were they? We can think about what mechanisms would be useful with new policy levers. And the classic example in economics would be something like the minimum wage. There's been a lot of research on the minimum wage. We have economic theory that says it would cause unemployment, but then we also have a huge amount of economic research saying it actually accomplishes its goals. It raises low-wage worker wages without causing unemployment. And we can evaluate those policies and then support them being passed by saying we have evidence that shows that this policy actually works, the same way we have evidence showing some policies may not work as well. And so the last two quick things I'll say too is that I think in order to do good research, it has to be intersectional research. I think everybody on this session and everybody in this room would really agree. This is not just like a nice to have, it's just bad research if we aren't looking at what we know historically are two of the biggest causes of economic disparities, which are gender and race. And so when I talk about the role of research in understanding causes, we need to loop that in. And then the last thing I'll say about real-time data too, I think it's more compelling when it's recent data. That's a piece of it. We need to know what's happening to build responses in real time. So I know research takes a while, but economic events can happen quickly. And that also, this is a big threat actually happening right now in our statistical agencies, that there's big threats to the funding of statistical agencies, particularly the Bureau of Labor Statistics and the Census have threats to their funding. And what's gonna happen when we don't have adequate funding for these agencies is not only will we get data maybe less frequently, but it'll be less accurate, particularly for these audiences that we're interested in talking about. Because when we're not sampling harder to reach people who are gonna be low-income people, who are gonna be immigrants, who are more likely to be people of color, then we're gonna miss being able to tell a story about them and understand what's happening to them. So that's, I think, a big risk too.
Yeah. Hi, everyone. So I guess I would think about it in three ways as well. Is this the right thing? Is it the right tool or policy? And then trying to figure out the right messages. So I think I'm a lawyer, lobbyist, and I remember as a baby lawyer looking at the state survey where it's like, what's the lay of the land? What's going on? I may not be an expert in everything, but a quick place to get the information. It's always helpful if it's every year because you're not looking at stuff from 2 years ago or things that are just completely outdated. The other part of it is the repository of information, so you don't have to go to different statutes. Like you can go to this one, and I'm gonna sound like an ad for Guttmacher, I don't mean to, but they're a group that we've worked with over time, that I've looked to over time. So people are already doing the analysis. I joke that the last time I took math was when my last year in high school and never looked back. So having a place that you can trust that the data is the right data and having it done or presented in a way way that's digestible. Sometimes I've read studies and I'm like, I have no idea what that said. I've read it twice and I wish there was like a more basic level thing, because when I talk to legislators, I need it to be even more basic than what I read. So I think that's a place where it's really helpful. I would say that historically has been what Guttmacher was for like repro related issues. And now it's that plus. So I think one of the really great features they have, and I'm critically with it, and I don't know if folks know Kelly from earlier before, she works at Guttmacher, but it's not just like what the data says, it's the real time, like what's happening now. So after Roe, I remember having a conversation of like, we're going to show like not just where the states are that people are going to, but asking policy questions as part of the data. And I think one of the things that was really helpful was to talk to people who do policy work to figure out what are the things that are most helpful to you. And some of the things we knew. So I knew, and I could tell legislators, people are going to come to Illinois. That's why we made changed our laws. Hey, Dobbs happened. People are coming to Illinois. We work with partners like CAF, the Chicago Abortion Fund, other providers on the ground. They're telling us, they're telling legislators. We're all telling them, and to have data that says in real numbers, this is what it looked like, shifted things a little bit. So when we're making, so for people who are with us, they're always with us. For folks who are like, well, I'm not so sure, we can say, don't just trust me, trust this neutral source, which is the information. So I think that's been a really helpful thing to have that real-time data. So we're not trying to figure out, like if we're gonna ask for more money for funding for abortion care, we don't have to guess like that was last year, what is it gonna be? It's like month by month information that's been really, really helpful.
Building on this a little bit more about the need for real-time data, I wonder if each of you can talk to, research is sometimes incredibly slow. I think, Khadine, you mentioned having, data that's like not more than a year old, and the economist in me is like, oh my God, that's amazing. That hardly ever happens. But would love to hear from all of you about, how you can have real-time data and research that is responding to current news cycles that is moving, honestly, what feels like too fast, like there's a little too much news happening, but how you kind of break down that silo. You want to go in the same order, or you can take it?
Sure. I mean, I think it's not a perfect science, and you're certainly right that there's some data that the lag time, like the pay gap data, has a substantial lag time, so it only tells a piece of the story. I think the best solution that I would say to anybody is that you have to be in conversation and collaboration with folks who work on an issue. None of us can work in silos, whether you do research, whether you do advocacy, whether you do work with grassroots folks. Really, if you're really trying to move an issue and address a problem, then you need to be talking to the full range of folks who actually work on an issue, because it may be the case that the particular data source that you're talking about has a longer lag time. But then there might be some data that is shorter. During COVID, there was some more real-time data that was produced that showed some impacts on how people were using funds and so forth. But also, sometimes anecdotal stories tell a lot. We've learned a lot post-Dobbs simply from folks on the ground and hearing people's stories and hearing in real time people going to a hospital and not being able to get the care that they need. And sometimes that real time storytelling is more impactful than any piece of research because it tells something, a story that people can relate to. So I think the most important thing is to be in conversation with each other, because when those stories happen, when the person in Texas and Arkansas and Louisiana, Mississippi, all seemingly disconnected, have the same story, right? Like then you can thread that together and say, well, actually, when you look statistically at the folks who are impacted, you can tell that the lowest income folks are the ones who are most likely to have to travel long distances. So you can use that research that may have been developed over a longer period of time, but to connect those stories together. But you can't do it if you're not on the ground with folks and talking to folks. And I think that's true, quite frankly, whether or not it's a research issue or not, right? Like nobody should be making policy in DC and not talking to real people, right? And nobody should, I don't mean to tell researchers how to do their business, but it's better if you're not just doing research in the four walls of your academic institution, never having conversation with people who actually are affected. Because what will happen is, and I've had this happen, someone will have done a really great piece of research that doesn't answer a single question that you have. And because it takes so long sometimes to build it, it's like, I wish you had talked to me beforehand, I could have told you, right? So I think there are opportunities, and one thing I will say about IWPR or Center for American Progress or Washington Center for Equitable Growth or some of the wonderful think tanks that are out there is that they sometimes do a little bit of both, and they often are working in coalition with groups who do advocacy, or some of the groups, we do research too, not in the same peer-reviewed way, God help you, but because we are in conversation working on the same issues, then we can work together, right, and make sure that the work that we're doing is actually informed by what's really happening on the ground.
Yeah, that's helpful. Kate, and I just want to jump in. It sounds like, the stories that we're getting in the last 2 years around reproductive justice is maybe an example where we're leaning more into breaking down the silos, but if anyone also has an example where they've just seen it go terribly wrong, I think that's also helpful to hear about how not to do this particular type of work.
Yeah. I also feel like, do people realize that academic publishing can take like 2 years from when you submit a paper to having it published? It's a really long time frame. But I was actually at a really good event that the National Partnership hosted between researchers and advocates on reproductive rights. And this was, I think, when I was still at Equitable Growth a couple years ago. And it was amazing to see this happen in real time, because researchers sometimes just like answering questions. We're very curious people, but they might not be the questions that people need answered. And so we saw this happen in real time. They were doing really important research. It's still really relevant research about things like clinic congestion and how long people are going to have to travel. That's still really important. But they thought, we don't really need to model the impact of a national abortion ban. That's not going to happen. And the advocate said, yes, you do. Like, that is the research we need to happen. And because I think there's sort of fundamentally, like, a lot of the problems we're dealing with are not new problems. And so there's research that I think is relevant across time that we know is useful. Like, we've known that there's threats to women's reproductive rights forever. So I think there's research that may not be new that is still really helpful to explaining things. And so I sort of want to emphasize the importance of even just translational work, of research that's already existing, and finding ways to make it relevant to the current moment. And I think alongside storytelling, I think it's really powerful to have individual stories and then also research from the past that may not be a perfect corollary backs up what we're seeing here. And so maybe it's something like we see, what's happening to a lot of women, particularly in the South of the United States with these abortion bans, but we can look to previous research on trap laws, on gestational limits. We can say we know from previous research that these individual stories are part of a bigger pattern, and we can estimate what the impact will be. So I think that's another way to sort of have real-time analysis, even if it's not brand new research. I think we can have that. And then the last thing I'll say too is a good lesson I got, I think, my first year as a baby economist at a grad school, of like summary statistics are actually one of the most important narrative tools in economic policy and other policy areas. I love to do a nice sophisticated regression. Like, I love to do all that stuff. It helps explain it. But fundamentally, what do policymakers understand? It's just going to be descriptive analysis that you can get out pretty quickly. So I think, that is actually one of our most important tools.
I think relationship development between organizers, organizations, advocates, and researchers can be really helpful. I think the moment I realized if you could find researchers, and they don't have to be those people over there, sometimes in your local community, so like Illinois, at the university level, there are researchers there, and asking them, hey, we have this thing, can you do it for us? I mean, sometimes it's a yes until it's a no. So I think even for a long time as a policy advocate, I didn't know who to go to or what's the context. I think that's where funders, if there are funders in the room, they can be really helpful in terms of if you're funding researchers and you're funding organizations, making those connections. And then the conversations of like, what would you like? Like, so if you have that relationship and you're talking about an issue, as advocates, we kind of know what's the short-term thing and the long-term thing. Like, I think about it from a policy perspective. There are like the bills where I would have sticky notes, at some point this bill will pass, and then the things we know we have to pass now or the time is right. So to be able to have that kind of conversation where you're able to say, in the long term, this would be helpful. Researcher, if at some point soon, later, you can do this, that could be useful, and then maybe at the right time, you'll have the information, especially if it's something that's going to be longer. Focus groups are super helpful, and I don't know for like researchers if that's a bad thing to say, focus groups. I don't know the dynamics in that academic world. So, but it's really helpful. Like we've done focus groups around criminal justice issues and around sentence enhancements. And it was super helpful to talk to people from, and of course, it's always the suburban white folks who are concerned about crime, and to say, what do you think the sentence is for Illinois for this particular crime? And they're like, well, we think it's 10 years, but we know there's date for day credit, and it's probably 5 years for this thing. And then when we say, no, it's actually 40 years, there is no day for day credit, and getting their reaction is super helpful because we have the stats about safety, then we have these people, and to be able to say, well, this person from your district had this thing, it comes together in a really great package. You're meeting legislators where they are in terms of the information that they're interested in. I think in a place where it has not worked is around like some of the policing work that I do where, so we're always fighting against over surveillance of communities and the use of technology. And so, for example, you get law enforcement who say, I need an automatic license plate reader. That's going to make the city safe. Or I need, like in Chicago, you may have heard ShotSpotter. I really need ShotSpotter because that's going to make the community safe. And then fast forward. So ShotSpotter, it's essentially this device where it's mostly on light poles, and if there's a gunshot, then it triggers an alarm, so police officers are able to go there to address the crime issue. Chicago has had ShotSpotter, a contract forever. It has not made us safer at all. And each year you have law enforcement asking for the new gadget, right? But there's no data or research that I've seen that shows that one of the things, like in terms of policy, that we've tried to push is, if you're going to ask for this new technology, what's your proof that it's actually going to work? Like, and we know from our conversations that it doesn't. We know from talking to communities it doesn't make them feel safer, but the data hasn't allowed that research to happen. And even in talking with some research folks, it's like, it's hard to prove a dispositive, so I think that's a place where I don't know what research or data would be doable, but the impact could be huge, where if law enforcement has to prove that this will make people safe, how we define safety, and if you don't have that, then you can't use it. I think that's a place where I just wish that it's easier for law enforcement to say whatever they're saying without pushback, but to have the right data to be able to make that counterpoint would be great. And it's been years where I'm like, who is that magical data person? So if that's you or you know somebody, please let me know.
There will be someone here.
You know, I think the point was really well taken, and it reminded me of something you said earlier and Kate said earlier, because I think it's really critical for research not to happen in a vacuum. And a lot of times researchers know things that people asking them may not fully understand. And so when Kate says it has to be intersectional, there's a reason for it, because I know one of the issues with some of that research, that technology, is like some of the facial ID was bad for Black folks, right? And there's some issues now around AI where it learns discrimination, right? Like unless you control for it. So the researchers and the tech folks are the ones who have the tools and the capacity to really figure out, well, how do I fix this problem? It doesn't just happen in a vacuum, but it only works if they bring that lens to the table, right? So some of the critical sort of questions that you have to ask yourself is, what does this mean for gender? What does this mean for people of color? How do you actually use it? And you have to be in conversation with people on the ground, because otherwise it can be misused, right? Like, and I think, you know, in a moment where we're dealing with a lot of research and a lot of technology, we also are dealing in a moment of incredible misinformation and misuse of that information. So it's incumbent upon us to actually have those strong networks.
I think just add to your point, I think that's part of the implementation, because So if we're moving legislation, I only have so much chips I can use, right? So making sure that the thing we're asking for is actually the thing that will work in the way we intend it to work. So I think that's where, and we're looking at AI and having parameters there, but being able to talk to the technologist, the researcher, the folks who can give us messaging is really helpful so that we aren't asking for something that can't be done. So we pass a bill, we're really excited, and then community people are still like, nothing's changed, right? Because yeah, there may have been numbers there from a study I looked at, but in terms of practical application, especially as it relates to local issues like that, that intersection can be very helpful.
Yeah. That's great. I wanted to dig in a little bit on relationship building, which I think all of you have sort of touched on, relationships between coalitions and researchers and advocates, policymakers and researchers and advocates. I just wanted to ask each of you, I'll start with you, Khadine, if you don't mind. Talk a little bit about the leveraging of relationships that you've done. You've talked a little bit about using focus groups, having constituents, but yeah, just a little bit more about how you do that in the state capitol.
Yeah, I mean, I would start with meeting people where they are. So at the ACLU, we're nonpartisan. We work on a bunch of different issues. So that term, no permanent friends or enemies, is very real because sometimes our best friends are very not excited about our positions on other things. And there are some times where the most anti-choice, anti-LGBT people become huge privacy champions. So that's the reality that we exist in. So meeting people where they are, and over time, I remember my first fact sheet was like 8.5 by 11, 10-point font, all of the information, pictures, stories, everything. And like my new self is like, who were you and how was that supposed to work? And now I find that legislators, I joke that we need infographics now or memes because that's just the level of focus that folks have. So figuring out for the right legislator, what's the thing that gets to them? There's some people who love a study, so you give them a little snippet of it, a bullet point, and then give them more if they want it. And then for some people, we talking about communities of color. There's some legislators, if I talk about communities of color, automatic shutdown. They don't care because they don't care about Black and brown people, and that's the reality. But they do care about economic things, so that's the place that I go to. So I think meeting them where they are. I think for researchers, and maybe because I live in Illinois and I'm an affiliate, the local connections are really important. Like partner with people on the local level because there is sometimes a lay of the land that could be helpful to share. So what may work as a national research thing, and you may have talked about Illinois, we can share like, that sounds good, but it's not gonna work here. Or here's the kind of thing for this particular issue, which would be a better focus to take. So you're not wasting your time. We may not be using your information if it's not relevant to what our reality is. So I think that would be something that's important as well. And then briefings. So using info briefings, but also doing it it could be by caucus, it could be by party. Figuring out, again, for those legislators or your target people, like what's the thing that's super helpful. And then the other thing that we've done is like office hours. So on our repro bill, I think it was the RHA, and looking at Kelly because in her old job, she worked at Project 6, and I was like, Kelly, I need people from states where they're banning abortions to come talk to our legislators about it. So they had, thank you, people come in, talk about why here, you in Illinois, you're able to do it. We need you to do it because from our state, we can't do it at all. That combined with having an office hours, that was just a place where legislators could just ask any of the questions. So we had a doctor, we had a comms person, we had us as lawyers and lobbyists there to be able to answer questions, like whatever it is they needed to know, even in terms of the stats about the safety of abortion, like all of those things. That's another tool that was super helpful.
Yeah, that's really great. And now I'm thinking about, I wonder what my very first fact sheet looked like. I feel like I kind of want to go back and look and see just how terrible it was and how little facts it actually gave us.
Oh, I had a lot of facts, too many facts.
I mean, maybe that was the thing. It was actually just it was just a report. Yeah, that's right. That sounds like me. So zooming up a bit to the national level, Jocelyn, I'd love for you to give an example of an effective partnership of a research and policy institution and how that would look.
That's a great question. I mean, I think the best examples that I can think of recently is, we, along with several groups here, work on paid leave. And We've worked on paid family leave for many, many years, and have a history working on unpaid leave and helped write the original Family and Medical Leave Act. So we have a long, deep history. But one of the things we learned through the FMLA process is that you need a big coalition of folks in order to actually get something over the finish line. You know, what has always been clear to us is that you need to be in strong partnership and collaboration with folks from the very beginning. And I will say that, you know, one of the things that is true, I think, in our ecosystem is a lot of times groups want to be the group, right? Like you want to be the end all and be all to every, and say, I do it all. And so it's counter to what I think we need to be, which is that we don't all do it all. You know, we actually have a bunch of folks who can do a lot of different things, and it's better if each person can sort of take ownership of the project, right? Like nobody wants to be at a table where there's sort of an afterthought. So I think, you know, from my perspective, one of the things we knew early on is that we needed the research, we needed the economic case, we needed the business case, we needed the individual family case, we needed to be able to make the argument as strong as possible that paid leave was essential. At the same time, we had to be able to tell the story. We had to have groups on the ground who said, you know, this is a problem for our people and here's why. And we had to be able to have the narrative across political affiliation, right? And we had to have also the people who understood how agencies work, understood how the White House works, and we had to have people who understood how the Hill works. Like all of those pieces were essential, and over time there have been many different iterations, and now we have a Paid Leave for All coalition that's led by Dawn. Dawn was on another panel who's amazing, to help bring all those pieces together. And I think I cite it as a really good example because pretty much everybody who's part of that coalition can get you the answer that you need. If you need real people, we got the people who got real people. If you need the research, Lord knows we got the research in the data. And we can tell you the business case and like all of those pieces. So I consider that a really successful partnership. And at some point in that process, a lot of groups had to come to the table and say, this issue is more important than any one organization. And we need to figure out how to come together in order to move it forward. And that also helped move us forward. So for me, that has been a really good collaboration and a good example and ongoing. And you know, it's my view, it's not if, it's when it's going to get over the finish line. But when it does, it is because all those pieces have come together.
Yeah, that is great. That is just like a really good example. I hope we marshal that and move it forward. Another big part of thinking about, and I think Khadine and Jocelyn, you both mentioned this, is bringing in folks at the beginning of a research design. So Kate, I'm wondering if you could talk a little bit about how you are, thinking about policy solutions at the beginning of a research agenda and what that, what the relationship part of that looks like.
Yeah, I mean, I think part of it is listening to people and understanding some of what we should prioritize as the biggest issues. But then, I think a lot of it is like, this is what my team tries to figure out every day, hopefully successfully, probably a lot of struggling of, how do we do research that actually points to solutions and doesn't just answer questions. And so I think, we've heard a lot of really great work here today about sort of what are these structural factors that are leading to these disparate outcomes. And there are things like the historical legacy of slavery. There are things like the devaluation of care work, particularly care work done by Black women. But how do we think, like, what's the policy solution then? We can understand those things, but what's the actual policy solution to these like huge sociological issues? And that's where I think we need to think about sort of like, what are the mechanisms that lead to the disparate outcomes, which is a slightly different research question. Sometimes understanding those causes does help because, of course, these historical legacies have shaped our current policies, but I think we can also think about sort of what are some of the mechanisms that lead to different outcomes to help us point to different policies that might be useful. So one example I think of is, for example, the racial wealth gap. And for the racial wealth gap, we know that this is caused by the legacy of slavery, and we know reparations would be probably the best policy solution, but reparations is also really a huge policy solution that might be hard to get over the finish line. And so what does wealth actually do that leads to the different outcomes we're seeing today, and how does that help us understand what policies that we might be useful? And so it might be understanding what degree is it lack of access to education or debt-free education. Is that a piece of it? And how can we understand what the solutions would look like there? Is a piece of it housing and being able to use housing wealth to leverage that into other things? Is it, if you're a small business owner, not having access to capital, and so you take out smaller loans, you're less likely to be a successful small business owner? What are those actual mechanisms that go from wealth to disparate outcomes? And what policy solutions can we do to target those specific mechanisms? Because that might be also where we find research that's a bit more actionable in the short run, which is I think a lot of what we're trying to do here too.
Yeah, that's great. Oh, I'm keeping track of time, and now I think we're going to move to audience questions. Is there a process? There's a mic coming around? Okay, great. Yeah.
First off, thank you for your responses to the questions already. Hi, my name is Frye, pronouns are she, her. I'm a 16-year-old from Solano County, California, who founded a reproductive health club there, and we do a lot of reproductive health work and a lot of policy work. So actually currently on the governor's desk, we have a mental health bill that I wrote that's going to get signed into law, so super exciting.
Nice. Congrats to you.
Yeah, thank you so much. And so actually now we're looking at that, that implementation and the policy, like how we see the impact of it, right? So we have seen impact of it doing like research in our communities and across the state, but now looking at like how would this impact people with this actual education? It's the research that we're trying to look into. But this goes into a larger issue of just access to research firms, access to people who already do research. Mm-hmm. And so as an advocate personally, sometimes we are forced to do the research. We don't have access to the people who have the funding, who have the resources to make quote unquote good research, because we're forced to do it on our own. And sometimes we feel like we're forced into silos, and we want to understand how to get out of that, how to get out of just doing research in the advocate space and reaching out to you guys who do, research in actual firms and have access to, ways to do surveys across the nation and not just in your local community. So how would you suggest, getting out of that silo? How would you suggest reaching out to those people who look at me as just a 16-year-old who has done that maybe incremental change, but doesn't believe in the research that we are asking for? Because even you touched on it, right? That researchers do these specific questions, but don't actually hit the questions that advocates want answered.
Mm-hmm. Can I just say, I have to say this. You said so much in a sentence. I'm 16. I wrote a bill. I did a report. I organized the government.
Professional advocate.
I know, really. Good Lord, you are fabulous. So it's so impressive. I have a thought, but Kate, you may, or Janelle, you may have additional thoughts as well. I think I define research really broadly, right? And so I think the research that you do is really important and invaluable. And there are projects where people work with students and folks on the ground to do research in sort of a different type of way, because it also can be very effective. So I would say a couple things. You should credit the research that you're doing, but also I would engage organizations that work on similar issues to see if they can advise you on how to strengthen your research. Maybe they have somebody on staff who wants to do research and will work with you, and you can tell them some of the questions, and maybe they can identify an academic at a local institution who might want to partner with you. Because I think you can do research in a lot of different ways. I mean, we at the National Partnership, we're an advocacy organization, a legal advocacy organization. But I also think research is really important, and we hired somebody who's more like a traditional researcher, a couple people, because that was really important for me. But it is different than me going to IWPR or Washington Center for Equitable, where I know that they are working with academics who do that sort of 24/7. So I think all of it is really important. And it's really more about how the research that you're doing can complement other sorts of research out there. So I wouldn't be shy, and you're clearly not. You're probably going to be the governor or something. But don't hesitate to reach out to some of the folks who are working your issues, because I suspect they would be more than happy to work with you on it.
Yeah, that was really great.
And then just one more thing to add, we are IWPR's grantee, so we have
nice.
the 25,000 from them, so
Oh my
hopefully
God.
that works in terms of coalition building. And we also opened a Repro Health Center, so we're doing, trying to do research in that sector. I'm not trying to like brag or anything, it's just like, I want
impressive.
to explain
It's
to you,
so
like,
wonderful.
we want to do research in these areas, like Solano County, which is where I'm from, has a high rates of chlamydia, gonorrhea, and the closest Planned Parenthood is 25 miles away from the community college. I'm the student trustee of that college, and I have students coming up to me and asking me, like, where do I get these resources? And so I'm wanting to just give statistics so I can pass policy that would help them in that way. And so that's why we're really trying to do research, because people don't really believe in our testimonials. People don't believe in our voices. Yes, narratives are so important, but sometimes they come up to me and like, they say you're lying, like that's not real. And so I want to be able to give that quote unquote statistical data that they want to see in a way that they'll actually believe what I'm saying.
Yeah. So, I mean, this is a really, really important question, and I feel like this is such a failure among researchers. Because a lot of people in the spaces I'm in became researchers because we want to be activists and because we want to support these types of movements. And like clearly we're failing at that if we aren't able to connect to those people. And so, for example, one of the spaces I'm really involved with is the feminist economics world. There's the International Association for Feminist Economics. If you're someone who goes into feminist economics, you're doing it because you want to support work like the work you're doing, but they're still pretty siloed. They're siloed but open, so it's like a little bit of a catch-22 that I said there, but I think one way to find these researchers too is not necessarily going straight to a researcher, but finding these communities of researchers that usually do have some sort of organization involved with that they work with. And so it could be a community of sexual reproductive health researchers. It could be feminist economics researchers, that they have associations that you can get connected to. And that's where you sort of open the door to a wide variety, because I think they're hungry for it, but they also don't know how to connect to real people. So I think that's one thing about academics and economists in particular.
Academics? Economists? No.
So I think they want to be part of this too, but they've done a terrible job. But if you can find their coalitions that already exist, that's one helpful way. And you mentioned local academics too, and I think particularly here in California, the California state school system is wonderful. There's a lot of great economists at each local university doing some of this work, so finding those ways to get connected to them. I'm sure you're already trying to do some of that work, but there's some great people also within local communities who also, they do policy work because they want to change the world, but they just don't know how to connect to real people.
I think a policy solution can be like, so, and this may be too late for your bill, now law, hopefully, and we could amend it to have a study committee. So essentially, you pass the law, and part of it is data collection on the kinds of data that you think is helpful for your community, and then creating a study task force with community members, always way more community members than any other group, academics who specialize in fill in the blank, organizations who do fill in the blank, and then require a study to be done. So we have one for traffic and pedestrian data. So every 2 years, this group has to meet and talk through how the data is used, what things you need to add to it. Then it comes out with recommendations, and that way it gives you some leverage. I would recommend that for friendly states on the issue versus other states, but California, that seems like a model that could be used.
Thank you so much.
Thank you. Others? Why don't we take all three of these questions, and then we'll have folks pick the one they feel ready to answer. I'm being told we cannot go over time because folks have to get back upstairs, and then they have to change and party. I think it's part of the agenda.
Okay, hi, my name is Ashley McGowan. I'm a guest here. I'm not a researcher, a policy person, any of those things. But I work with you a lot in my day job at Meta. I work on our marketing team, and I'm trying to figure out the third siloed breakdown here, that is research policy, and then what can I do as a marketing professional who has understanding of how to utilize our social networks to scale a lot of what you were just talking about in terms of taking the research and making it a little bit more actionable and kind of like dumbing down for people like me who are not necessarily sitting in this space and understand the language that you guys are talking on a daily basis. So just a couple tips on how can I actually help my research and policy teams.
Nice. Let's do I think the person next, did someone next to you have their
I
hand up?
was just, I was full
Oh,
screen.
okay, I think there was a question. There's a question over here.
Yeah, I don't know if it's, maybe it is a question, but Shakira Washington from Justice and Joy National Collaborative. As a researcher, I mean, I've been in this world of research for a really long time, and I have to admit that what this young person is saying is so true. I mean, the gap between what happens in academic and institutions and think tanks and what's happening on the ground is gigantic. And trying to break through that kind of siloed way of doing this work is really a challenge that I think we as researchers really need to think even deeper about, and really think of some real solutions. I think there's so much competition, unfortunately, that kind of happens between our organizations that sometimes we really are leaving out a lot of folks. And especially, we do a lot of work with girls, gender expansive, young folks of color, and really like even a lot of research that we're talking around in terms of wage gaps and reproductive rights and any number of things. Like we're kind of forgetting a whole group of folks oftentimes, and that's young folks. So, it'd be great if somebody, had different ways of sort of thinking through, like, how do we even continue to further break down those silos and really bring in folks into these conversations in a real kind of way. That would really be fantastic.
Yeah.
I think like offering trainings on how to do research, right? Like basic, like this is research, so that folks are able to also understand like, oh, what I'm doing is research. And especially if it's connected to some institution. I was trained by fill in the blank entity to do this, and I think that could be a helpful thing. The person from Meta, I think knowing that you exist and that you're available for folks can be super helpful, because if I had your card, I would call you all the time to be like, you said you were interested, and just following up, which is why I bother Kelly so often, because she offered. I think knowing who's out there, because there are times where it'd be like, I wish I had this person, and you have no idea who to go to get that access. And I would then again put the plug to funders. Like, if you're funding grassroots folks and like, you're getting funding from this entity, like who's ever funding you, or you, whoever is there from the organization, like when you're talking about funding, pulling that into it, because that's the way to maybe develop those relationships, make those connections. It doesn't cost the funder anything sometimes, or they may want to fund a project with young people and somebody else that they're funding, or it may open up an opportunity for like really good academics and researchers to be funded for something they otherwise wouldn't be funded for.
Yeah, I appreciate your question, and I also think comms and marketing is so important, and part of the issue here is like devaluation of feminized labor, frankly, that I think that is, at least in the space I work in, researchers are sort of held up to this high esteem, and the fact that the people who have expertise in figuring out how to make that research reach people are not held in as high esteem is like also a type of devaluation of feminized labor, because comms teams do tend to have more women on them than research teams do, typically speaking. So it's something I care a lot about, I think is really important. I think you have to demonstrate to researchers what are the specific tools they could be using and they should learn to use. It also forces them to have respect for your expertise, because it's things like media training and putting someone really through the ringer with media training, and they're like, oh gosh, I'm really bad at this. This person is really helpful, or op-ed writing, or things like that I think are really helpful, because you learn that they are such important skills and you can train researchers to do it. And then what happens, I think, at least in my experience as a researcher, having worked with comms and marketing people for so long, is when you as a researcher actually say something to someone that they understand or really strikes a chord with people, it's actually such a gratifying feeling that you're like, that is, wow, people reacted positively. I love that. So I think giving people those specific tools, making it really clear what those specific tools are, and then hoping that it demonstrates to them that they are useful tools to have.
I mean, I think the only thing I really want to add mostly to Shakira's question is I think it matters enormously who's doing the research. And we really haven't talked about that enough. I think that it matters if you have more women and people of color doing research, because then they're asking the questions. I remember, I think, a conversation that Kate and I had many years ago where I think, I'm maybe saying this poorly, there's a strain of economic thought where they wouldn't actually consider gender, right? Like there was, it was sort of like, it was like an afterthought. It wasn't the essential part of the equation. And there's work in the health equity space. One of my colleagues is here who does health work. And I remember one of the doctors that we worked with said that it used to be the case that you affirmatively were told never to talk about racism and sexism in the context of healthcare, even though we knew those factors mattered. So I think the tide is shifting in part because the people doing the analysis and asking the questions are different. And so I think it's a reminder that even in a moment of anti-woke, anti-whatever, it's partially in response to the fact that we have had more people challenging the status quo and the traditional way of looking at questions that may have ignored these factors. And I think that's so critical. The last thing I want to say, just coming back to you and your point about storytelling, I think there are a lot of people who like to invalidate people's stories and say it doesn't matter, it's not useful, it wasn't, told by the right set of people. Ignore all of that. Your story is your story. And part of the reason that you want more diversity of people on the Hill, people in companies, people in research, is because those people understand that your stories matter, right? Like we don't broaden our concept of whose stories we're listening to unless we have more diverse people who are actually doing the research and the thinking about those issues. So they go hand in hand. And the last thing I would say is sometimes people push back on your stories not because they don't believe them, but because they know they're true. Right? Like there's a whole reason why there's an effort now not to talk about race and ethnicity and to say it doesn't matter and not to collect data, is because they know the data is bad. Right? Like they know, it's not because they don't know, they understand the disparities that exist, but they'd rather create a space that sort of doesn't hold them accountable. So from my perspective, sometimes when people push back, that just means you tell more stories, right? Like because you have to constantly put it right in front of them, because there are a whole bunch of folks now trying to mask over the reality of what our country looks like. And this is a moment where we're in a fight. We're in a fight for the narrative, and when the narrative doesn't look good, they'll do a lot of things to try to, take that narrative away. But that's not. I think our response is always to tell the story, right, and make sure that the right people have the ability to tell the story.
Really quick, two quick points on this, because I remember talking about some of this research about who does the research really matters for the questions being asked. So there is research in economics that finds that women economists come to different conclusions than men economists. Men tend to say market forces will solve all of our problems, and then women economists tend to say, actually, we think policy and government interventions are also effective. And these are equally qualified researchers, but they, because of their lived experiences, come to different conclusions with the research. And then the last point I want to make too is that it is important to have diversity, and then there's sometimes you find that pushback that if people are researching what strikes true to them based on their own lived experience, it's sometimes discredited as being biased research. So I know that's probably something people in this room have experienced a whole lot, but you keep telling the story. And then I think what is really powerful too is keep in mind that academia is really gatekeepy, if there's academic researchers here. But when you take these stories, when you do really good research that strikes a chord with your own identity, it's probably going to strike a chord with advocates of that identity, policymakers who care about those groups. There are other people that will validate that research if it's not the sort of silo of researchers. And so I'd encourage researchers to also, partner with those people, because they will find that research really helpful.
Yeah, that's great. We have 2 minutes, so we'll do one quick lightning round. One thing to do and one thing not to do to break down the research, break down the silo between research and policy. And Khadine, we'll start with you and go this way.
I will use my little time for a different thing. I think one thing.
That's
One
absolutely
thing to name
perfect.
is that we're in a time where facts don't matter to a lot of people, and I think that's the parking lot issue for us to figure out. That even if you have the best research, the best story, the best messenger, all of those things, sometimes the other side has a lie that is so oh my God, this lie, the image that I get is so good. And it's a hard thing to figure that out. So naming that as we do our work, it's been that way before, but it feels like it's even worse now. And so maybe as we continue to be here for the next, until tomorrow, we can talk more about that, but just wanted to say that out loud.
I'm appreciating that, and it is horrifying and true.
This may not be good advice, but I think it's a good thing to do is go to academic conferences, even if you're not an academic, because as much as academics need to talk to real people, I also think real people can go talk to academics, and the conferences might be a good way to do that, because you can see a whole panel of people talking about the same topic and go up and talk to them afterwards and tell them that maybe it doesn't match what you know, or maybe it does. So I think that's a good way to sort of break down a silo, is to jump into those academic spaces and unashamedly. And then the thing to not do, I had one and now I forgot it. There's lots of things to not do, but now I forget my thing.
Jocelyn will go and we'll come back if you remember
maybe it'll come
that
back
too.
to me.
I was still trying to think about the answer to your question, but I
figured it out.
Okay, good.
So I think one thing to not do is rely on the hierarchies that exist in research systems already. And so this is something I see a lot. It's like there are great researchers at colleges in Cambridge, Massachusetts. I respect them, but there are lots of great researchers everywhere. Getting a PhD is really hard no matter where you do it. And so your community college faculty, your state college faculty, they will all be good researchers too. And so you don't only need to rely on those hierarchies within academia to find research partners that will have validity.
That was a good one, thank you. I think one thing to do is I would just say reach out to somebody who's not in your network. Whoever it is. If you're a researcher, talk to an advocate. If you're an advocate, meet with somebody who does grassroots organizing. Just, build the practice of reaching out beyond the people that you're normally interacting with to try to make those connections. Those things come back, right? Like there are people you may have met years ago who will come back and you'll find that connection mattered. And what I say don't do is don't let people tell you, let me say it differently. If you know a problem exists, then don't let people tell you it doesn't exist simply because, well, there's no research, there's no data, or then maybe people weren't asking the right question, or they weren't tracking the right information, or they didn't look. I remember once when I was on staff at the partnership, we looked at some data, and to make a long story short, it told a story if you only looked at it through a gender lens, but when you added gender and race, it told a different story, right? So, but nobody had ever asked the question, so nobody ever had that answer. So don't let people tell you a problem isn't a problem. If you don't have the data or the data doesn't exist, then talk to somebody who can help you figure out what's the question we ought to be asking in order to really figure out what's going on.
Amazing. Jocelyn, Kate, Khadine, thank you all so much for joining us.